Hello everyone. Let's check our last na preboard. So this is for the third week. I will create or I will make another video for the second week na wala na to na check. Okay? So for rationalization na purpose. So for third week, we have this one. HBC gihapon. Okay? Number 1. Jamie, while meeting with the psychologist, states that she has been experiencing frequent panic attacks brought by feelings of anxiety in social situations. The feeling of fear and anxiety are strongest whenever she is alone, in a large crowd in public spaces where there is no easily identifiable exits in case of emergency. So, Jamie could be exhibiting symptoms of which of these disorders? So as you can see, naa na diri ang answer. So ang naka-red mao na siyang answer. But ato lang kumbaga ato lang siyang i-explain nganong karaang answer para mas klaro. So balik ta sa situation. Si Jamie daw kuno, while meeting with her psychologist, nagkaroon siya og panic attacks because fear and anxiety is strongest whenever she's alone in a large crowd. Kumbaga, na siya sa isa ka crowd sa daghang tao nga area. Tapos, ang iyang concern is wala siya makita nga pinakadali nga exits if ever na ay isa ka situation nga may tabo. So, unsa ang tawag nga disorder nga iyang ginapakita? Letter A, agoraphobia, panic disorder, social anxiety disorder, generalized anxiety disorder. So the answer is agoraphobia. Pag moingon gyud agoraphobia, this is a kumbaga disorder kung asa mahadlok siya sa isa ka area, mahadlok siya nga wala bitaw siya makita nga exits or dili siya gusto nga kumbaga naa siya fear sa isa ka situation kung asa dili siya basta-basta maka-escape if ever nga naay situation nga may tabo. Like for example, nata sa school. So tapos ang isa ka tao kay karing nay agoraphobia. No. So nata sa school. Tapos sa ato ang school lisod kayo ang exits, fire exit, emergency exit and like that. So karon bisag walay nahitabo, gusto gid niya nga duol siya dito sa portahan. No? Di siya gusto nga dito gid siya sa pinakalayo sa portahan. So nga na. Or madlok siya nga kumbaga ginakulbaan siya nga layo siya sa mga exit or wala siya makita nga mga exits. Kay base ang iyang ginaisip, like for example, makalitag linog, naisunog, so nga na. Agoraphobia. So, dili pod siya panic disorder, though they have the same panic attacks, pero dili siya panic disorder. Ang man gud sa panic disorder is nagapanic siya without any kumbaga enough na reason. So dere sa panic disorder, if sa isa ka situation dili niya mapugan ang iyahang panic. Okay? Pero sa agoraphobia, bisag walay nahitabo nga situation is gapanic murag na siya panic attacks. Bisag wala gyud nahitabo good. As long as wala siya makita nga kumbaga murag easiest way out. So nga na agoraphobia. Which of the following information must be included for the family of a client diagnosed with dependent personality disorder? So, letter A, addressing coping skills. Why? So, when we say dependent personality disorder, nakadepende lang siya sa ibang tao. Like for example, na siya'y kumbaga na siya'y problem. In order nga ma-solve niya 'tong nga problem, kinahanglan niya og help from other people. Kinahanglan niya og help from sa iyabang family, so nga na. So ang atong gina-target is address coping skills. Kung asa pwede nga siya lang, di na siya maging dependent dito sa iyang family, sa iyang friends, so nga na. So coping skills ang atong gina-address. Okay? Pag naay dependency. Number 3, in planning care for a client with borderline personality disorder, a worker must be aware that his client is prone to develop which of the following condition. So, we have this binge eating. Okay? So, diri sa number 3. In planning for care clients borderline personality disorder, when we say borderline personality disorder, mao ni sila kato mga tao nga kung iba ang ilahang way of thinking para silang sarili. Somehow this is negative, no? Para silang sarili ug para sa ibang tao. So gana. And as a result, isa sa effects ani nga disorder is what we call binge eating. When binge eating, karibitang mukaon siya. Kumbaga murag ginatawag natog stress eating, no? Have you ever watched some movies nga kung asa ang isa ka tao or ang main cast sa movie is karang tawag karabitang tungod sa situation niya or dili siya gusto sa mga tao nga na is mukaon na lang siya, mukaon, no? Large amount of foods moto they became fat. So nga na siya binge eating, hilig magkaon og daghan ana. Okay, so a client with the diagnosis of narcissistic personality disorder have been given a day pass from the psychiatric hospital. The client is due to return at 6 p.m. At 5 p.m., the client telephones the worker in charge of the unit and says 6 o'clock is too early. I feel like coming back. 7:30, the worker would be most therapeutic by telling the client. So, pag ang ang client is for example a therapist, no, in order for us to help them, isa jud ra isang disiplina, no? Discipline is one of the most essential, pinaka-importante. So unsa daw ang ingon ni therapist dito sa iyang client? Return on time or restrictions will be imposed. So that's the answer. Kinahanglan kung unsa ang schedule, nga na gid nga time ang schedule. Dili gid siya dapat i-adjust para lang sa client nimo. Okay? A client with borderline personality disorder is admitted to the unit after slashing his wrist. Which of the following goal is most important after promoting safety? Okay, so number 1 sa ato ang ginabuhat when we are dealing with our client is building rapport. So the same with this one, we are establishing therapeutic relationships with the client. So, we should always create this therapeutic relationship, no? Because this is important nga para ang ato ang client is mo cooperate with us, with the therapist. Okay? A worker notices other clients on the unit avoiding a client diagnosed with antisocial personality disorder. When discussing appropriate behavior in group therapy, which of the following comments is expected about his client by his peers? So, the answer is letter A, lack of honesty. So, nganong lack of honesty man because mingon man na siyang kumbaga murag plastic bitaw. Mingon na siyang ay okay lang. Okay lang man, not good, not bad. So, lack of honesty. Bisag dili siya gusto, no? Bisag dili siya gusto, mingon lang siya okay lang. Okay? A client with diagnosis of borderline personality disorder has negative feelings toward the other clients on the unit and considers them all to be bad. The worker understands his defense is known as. So, we have this splitting. Kumbaga, ano ni ayahang sarili. Magbuhat siya og reasons, no? Magbuhat siya og mga reasons even dili tinuod para lang kumbaga na ano niya iyang sarili dito sa ibang members. So when we say ano man god borderline personality disorder, kumbaga na siya negative nga ginaisip towards siyang sarili and to the others. So diri nagapakita siya negative feelings towards other clients. Tapos ganyan nga naingon niya nga they are bad. No? This is what we call splitting. The client with antisocial personality disorder is generally unable to postpone gratification. So, is generally unable to postpone gratification. So, unsa pod ning antisocial personality disorder? So, these people are those who manipulates, exploit, and violate others' rights. No, kadalasan mo ni sila to mga ginatawag nato og criminals. So, the client with antisocial personality disorder is generally unable to postpone gratification. Dili nila makontrol ang ilang gratification. Like for example, gusto nila manakit. Gusto nila i-violate ang karapatan sa ibang tao. They cannot stop it. No. Maglisod sila og stop. Ting ana siya. Kung gusto nila mag-exploit sila. Sometimes mo ni kining mga bully. No. Mga bully and kato mga makakommit gud og crime. Okay? Okay. 9. A worker discusses job possibilities with a client with schizoid personality disorder. Which suggestion by the worker would be helpful? So the answer is letter C. Your idea of applying for the position of filling the organization record is worth pursuing. So, unsa po ni atong ginatawag nga schizoid? So, when we say schizoid personality disorder, these are people nga, kumbaga, na sila avoidance when it comes to social activities. No? Mga maulawon. No? Pag mingon ganitag, pag we are helping someone who is having this schizoid personality disorder, they need some appreciation. Imagine, maulawon na ganit ka, ignon pa kag maot. Diba? Murag samot nga malain ka. Samot nga, kumbaga, dili ka ganahan. Unlike if we appreciate them. Your idea of applying for the position of filling the organizing records is worth pursuing. Appreciation. Okay? So, letter C ang answer. Which of the following statements is typical for client diagnosed with personality disorder? So, letter A, I understand you're the one to blame. I must see, excuse, I must be seen first. It's not negotiable. I see nothing humorous in this situation. So, nganong tama man ni, nganong kariman gud ang tama, or the best. I see nothing humorous in this situation. So, there are people na um kumbaga they are doing something just for fun, no? Kumbaga para sila katawanan or something funny, no? So we must confront them and tell them that the situation is not humorous. Okay? Dili siya katawanan. And the client must take the situation seriously. Okay? Which of the following statements is expected from a client with borderline personality disorder with a history of dysfunctional relationship? So letter B, I'm determined to look for the perfect partner. So, nganong kariman natong gina-expect, no? Because when we say again borderline personality disorder gani, ginaisip niya na kumbaga ang ibang tao is something bad, no, or dili maayo. So kumingon taging ana para sa iya katuyang past relationship ang nagkulang dito ay ang iyang partner, though in reality siya gyud ang problema. So that's it. That's why kumbaga ang atong gina-expect dere is iyang iput ang blame dito sa iyang partner, though ang sala man gyud is iyaha. Okay, ang lackness or ang pagkukulang is nagyud sa iyaha. Then mingon pa siya, I am determined to look for the perfect partner. Okay, so which of the following characteristics of client history substantiates in a diagnosis of antisocial personality disorder? So we have multiple criminal charges. Katong as I've said gaina, ang mga tao nga may antisocial personality disorder commonly they are criminals or makakommit og crime because they violate, they exploit or they manipulate other people's rights. So nga na ginakontrol nila ang karapatan sa ibang tao. So usual nagid sila criminal charges. Okay, which of the following types of behavior is expected from a client diagnosed with paranoid personality disorder? So when we say paranoid, they are hypertensive. Baga kayo, dili sila seductive paranoid. When we say paranoid na ay karabitong karang ginatawag na paranoid, kitlag pangurog, no, mag-worry. So they have hypertensive. A worker is orienting a new client to the unit when another client rushes down the hallway and asks the worker to sit down and talk. The client requesting the worker's attention is extremely manipulative and uses socially acting out behaviors when demands are unmet. The worker should, letter C, tell the interrupting client to sit down and be client, stating I'll be back as soon as possible. Okay? So mo ni sila ang usual nga kaning mga client bito nga demanding. demanding. So in order for us to control this situation, kita gyud ang mangisog dili si client. Okay? So nganong ngani man atong buhatan because there are tendencies na ilaha lang tang isi-isihon. No. Okay? Which of the following conditions is likely to coexist in clients with a diagnosis of borderline personality disorder? So, people with borderline personality disorder are most likely to have depression. Di ba? They are thinking na other people or they are thinking negatives about themselves, silang sarili. And they are also thinking na they're unliked by other people. Dili gusto ang ibang tao sa ilaha. So, they are most likely to have depression. Ganun na. Which of the following behaviors by a client with dependent personality disorder shows the client has made progress towards the goal of increasing problem-solving skills? So, letter B, the client ask questions. So, they are willing to, gusto sila maka-learn. Gusto nila maka-cope up ang ilahang situation. No? That's why they frequently ask questions. A person with antisocial personality disorder has difficulty relating to others because of never having learned to pagmingon ta og antisocial, no, to mga kumbaga to mga may criminal nga acts, no, kato mga hilig mag-manipulate, exploit, mag-control sa right sa iba. Wala sila never have learned to empathize with others. Kumbaga wala sila empathy, no. Kumbaga dili nila ilahang maput ilang situation. Dili sila ka-relate sa ibang tao nga situation. Kay kung makarelate sila, they will kumbaga avoid exploiting others kung kabalo silang masakitan ng isa ka tao. Okay? So, next we have number 18. A worker notices that a client is mistrustful and shows hostile behavior. Which of the following types of personality disorder is associated with these characteristics? So, medyo saba, no? So, just focus lang. Okay? So, the answer is paranoid. No? Para sila dili katuuhan ang ibang tao. No? Wala sila matuuhan. Murag na sila, kumbaga paranoid sila. So that's it. A young handsome man with diagnosis of antisocial personality disorder is being discharged from the hospital next week. He asked the worker for her phone number so that he can call her for a date. The worker's best response would be I like you, but our relationship is professional. No. So, confront them. Always confront them. Always be frank with them. No. So, even kumbaga bisa unsa siya ka okay ang personal ay ang physical, no? Even naatay kumbaga ginatawag bitaw nga countertransference ba nga feeling with our client. We should always remember that our relationship with our client is professional, no, na ay purpose and naatay target nga goal. Okay? But after the I think pwede man after the therapy, after the helping process and whatsoever. No, ginaprangka gyud nato sila. Okay, which of the following characteristics is expected for a client with paranoid personality disorder who receives bad news? So the answer is the client responds from irrational, kumbaga mangita siya og magkuan yun siya og explanation. No, for example, si client or si ako, I have this paranoid personality disorder and I receive a bad news. No, like for example, bagsak ko. So the client responds from a rational, objective point of view. Mag-ano gid siya, hilig siya og kumbaga rationalization, explanations. No. So that's it. A worker is assisting a client diagnosed with dependent personality disorder. So which of the following characteristics is a major component of this disorder? So when we say dependent gani, that is over-reliance to others. Naka-rely lang siya sa ibang tao. Okay, number 22. A 20-year-old college student has been brought to the psychiatric hospital by her parents. Her admitting diagnosis borderline personality disorder. When talking with parents, which information would the worker expect to be included? Select all that apply. Pilion daw kung asa ang atong gina-expect. So the answer is impulsiveness, lability of mood, and self-destructive behavior. Okay? So muna sila ang mga dili man wala may psychomotor retardation ang taong na ay karing tawag ani borderline personality disorder. So naman okay ang ilahang psychomotor functioning, pero they have this impulsiveness, lability of mood, and destructive behavior. Again, si borderline personality disorder are those people who are thinking negatives about silang sarili and other people. Okay? Pero dili sila bugo. Okay. Which of the following assessment findings is seen in a client diagnosed with borderline personality disorder? So, letter A, aberration in various healing stages. Okay. When we say aberration, this is a, kumbaga, mura siyag samad. No? Samad sa panit kung asa caused by, kumbaga, rubbing in a surface. Diba? Kung naikatul sa to ang panit, ato siyang ginakalot. Handud sa mura siya og masamad, no, magburot, medyo masamad. So that is what we call aberration. So which of the following assessment findings is seen in a client diagnosed with borderline personality disorder? Naa siya'y aberrations. Dili siya literal nga aberrations but this is marabito siya mga mura siya og mga naging samad nga naayo. So, kumbaga nga na ang term, kumbaga nga na ang murag niya. Ang gina-point out niya is naay mga samad nga na-heal, mga naayo nga samad. No? So, aberration in various healing stages. So, next, a hospitalized client diagnosed with borderline personality disorder consistently breaks unit rules. This behavior should be confronted because it will help the client become more self-aware. So, we should confront our client nga ang iyang gipang buhat is dili maayo, dili helpful. No? Kay kung ito man gud na siyang i-ignore, i-tolerate, murag ma-normalize lang siyang pag-break og rules. Therefore, we should confront our patient or our client. Become para maging self-aware na siya na he is violating rules. Which of the following characteristics or situation is indicated when a client with borderline personality disorder has a crisis? Paano doon na ito mabalaan nga ang isa ka tao nga na ay borderline personality disorder kana ay crisis situation pag naa siya relationship problems. Like maglisod siya og ma-build og relationship with other people, like friendship, or even relationship good, so na siya crisis. A client with antisocial personality disorder is trying to convince a worker that he deserves special privileges and that an exemption to the rules should be made for him. Which following response, kumbaga, iyang ginamanipulate ang karapatan ni ang karapatan ni worker, ang katungod ni worker to decide. So that is antisocial. Which of the following responses is most appropriate? So kinahanglan, again, ang ginatawag na tug antisocial is uncontrolled exploitation, manipulation, and violation of other people's rights. So diri ang iyang ginapakita is manipulation and control. No, ginamanipulate niya ang karapatan ni worker to decide, to make decision. So ang atong response is, what you're asking me to do is unacceptable. So that's it. A client with schizotypal personality disorder is sitting in a puddle of urine. She's playing in it, smiling and softly singing a child's song. Which action would be best? Help the client to the shower and change the bed clothes. So that is the typical action. So ingan na lang yun. Very simple. Okay. So help the client to the shower. So unsa gani ni ulit ang schizotypal? So when we say schizotypal, they are the loners, no, na ay flat emotions. Mas dali lang sila ma-hurt. Medyo nipis nga emotion. Gamayng lang sila is maging emotional na din sila, okay? So, admonish the client for not using the bathroom. Kasabaan ba nato? So, dili because they have this flat emotion. Dali lang sila ma-hurt. Firmly tell the client that her behavior is unacceptable. Samot. Dili napot na to sila. Because again, they have flat emotion. Dali lang sila ma-hurt. Ask the client if she's ready to get cleaned up now. So, dili na to sila kinahanglan i-ask because we can see they are kumbaga they really need to be cleaned up as soon as possible. So help the client to help the client to the shower and change the bed clothes. Okay. When working with the worker during the orientation phase of the relationship, a client with borderline personality disorder would probably have the most difficulty in setting mutual goals for the relationship because they have this kind of mistrust with other people. They're thinking negatives gani, di ba? About themselves and other people surround them. Kumbaga, negative lang ginaisip. That's why maglisod sila og setting of mutual goals. Okay? When caring for a client with diagnosis of schizotypal personality disorder, the worker should, again, schizotypal, mao ni sila katong mga dali lang ma-hurt, no, loners. Respect the client's need for social isolation because they are kumbaga loners gani, di sila gusto og karing tawag ani sila kayo gusto og social interaction or interaction with other people. So kinahanglan pud ni ato silang irespeto ang ilahang kumbaga needs for social isolation. 30 which of the following nursing intervention has priority for a client with borderline personality disorder? So, main consistent and realistic limits. Again, what is borderline? Katong nagaisip og negatives. In easiest, gaisip og negatives about silang sarili and to other people. So, we should always maintain consistent and realistic limits. Dili ta mag-go beyond our limits. No, dili na to, for example, kung dili good mo si client or si ato ang patient, dili na to i-push through because di na sila mag-cooperate. Okay. 31. A worker at Worker Labs Medical Center is developing a care plan for female client with post-traumatic stress disorder. Which of the following would she do initially? So, do encourage the client to verbalize thoughts and feelings about the trauma. So, si client daw na ay post-traumatic stress disorder. So, excuse kay medyo ginaubo pagid ko. Okay. Asa na to? 31 again. A worker at Workers Labs Medical Center is developing a care plan for female client with post-traumatic stress disorder. When we say client with post-traumatic or PTSD, mo ni sila katong mga tao nga naka-experience or naka-witness og traumatic events. Like for example, na kita niya nga ang karing caused by natural disaster, no, naka-witness sila og mga traumatic events like disgrasya, giyera, natural disasters. So na sila sa traumatic state kung asa dili kayo nila ilahang trauma, ilang ginaisip, di kayo nila maingon because they are always thinking about the traumatic situation. So in order for us to be helped, no, usual sa ilahan nakatulala, so nga na siya katulala lang daw na una sa nahitabo. So in order for us na matabangan sila, we should encourage them to tell us their thoughts, no, verbalize thoughts and feelings about the trauma. Unsay ilahang na witness, unsay ilahang na feel. So nga na. A group of community workers sees and plans care for various clients with different types of problems. Which of the following client would they consider the most vulnerable to post-traumatic event? So, usual ang the answer is a 20-year-old college student with DM who experienced date rape. So, the answer is this one because okay, so again, the answer is a 20-year-old college student with DM. I don't know unsay ang gina-point sa DM because we have medical term or psychological term medyo lisod. Okay, so in analyzing questions na pag-abot diri sa exam, there are unfamiliar words. No, there are unfamiliar words nga dili na to mabalaan, di jud na to maano kung unsa iyang meaning. No, what I did during the board exam is crashing out. Pag di ko kabalo sa meaning, akong gina-crash out. No? And pag ma-crash out na nimo na siya, you just have to check if fit ba gyapon siya nga answer or fit ba ang question dito sa answer. Okay? So, focus ta sa ginatawag nga PTSD or post-traumatic stress disorder. Hubingan tag post-traumatic stress disorder, mao ni sila katong mga tao nga naka-experience og traumatic events nga di jud nila malimtan. Okay. So, pag ikaw isa ka 20 years old, college student, so i-crash out aning DM nga abbreviation, okay, di man ta kabaluan ni. So imong una to a 20-year-old college student with who experience date rape. So still fit gihapon siya nga answer. Why? Because date rape or rape attempts is a traumatic event. No, pag kumbaga nagani kay history of kumbaga na rape ba ka or attempt lang wala na dayon ng rape, di ba magkaroon ka og traumatic experience, feeling of trauma. So that's or therefore tama gyapon nga nag-rush out ta, so fit gyapon ang answer. And of course si letter B ang fit nga answer because siya ang naka-experience og traumatic experience. No. So si 8-year-old boy with asthma. So dili man siya traumatic event. A 40 years old widower who has recently lost his wife to cancer. So dili man siya not totally because that is caused by illness. Ang loss of loved one. Maybe other pa nga pero dili siya sa PTSD. And dili pod fit si letter D. But ang pinaka-fit is si letter B because siya ang naka-experience og traumatic event. Bisan pag mingon tag an 8-year-old kinder student who experienced a date rape. Tungod sa last phrase nga experience date rape, mao na siya ang traumatic event. Okay? So bisag mingon tag who experienced date rape lang ang answer sa letter B, tama gid siya. Siya gid ang answer because that is traumatic event. Which outcome is most appropriate for Francis who has a dissociative disorder? Okay? Karon diri na pud ta sa dissociative disorder. Okay, so letter A. Ang answer is letter A. Francis deal with uncomfortable emotions and on a conscious level. So when we say dissociative disorder, na ay mga, for example, thinking kalit lang, karabitong, nakalimot ko sa akong iingon. No? So, kumbaga, ang pag-process sa ilahang information is putol-putol. So, the answer is, Francis will deal with uncomfortable emotions on a conscious level. So, kumbaga, mag-iba-iba yung emotion. No? Iba-iba yung emotion because, kumbaga, ang pag-process ganin sa information niya is putol-putol. Therefore, uncomfortable emotion. Dili pare-pareho. The psychiatric worker uses cognitive behavioral techniques when working with the client who experiences panic attacks. Which of the following techniques are common to this theoretical framework? So, in order for the client nga mawala ilang panic, no, we should teach them about it. No, nga nung naipanic, unsay maging dulot sa panic, paano na siya i-overcome. So nga na, teaching the client about anxiety and panic. Okay? So, like for example, ikaw, nagkaroon ka og for example, mura siya bitaw, kare bitang giving naghatag tag education about it, no? Para for example, naka-feel ka nga mura kag nalipong, ka, na kay murag na feel nga lain sa imong lawas. Nag-search ka sa nag-search ka sa Google, because gusto nimo mahimutang karang ang mga symptoms nga mong na-feel, no? Gusto nimo mahimutang kung unsa gid imong situation, unsa gid imong unsa kay imong mga ginabatsyag, no? So you need to learn about it, okay, para mabalaan nimo paano na siya i-overcome. So the same with this one, teaching the client about anxiety and panic. So, no? So again, we have this agoraphobia. Anne Badjo only attends social events when family member is also present. She exhibits behavior typical of which anxiety disorder. Because ang agoraphobia, dili siya gusto ma-put into situation kung asa wala siya unescapable ba. And the other is maputang siya sa isa ka situation kung asa wala siya maduulan, no? Like diri ma-attend lang siya social events pag na ay family members nga present. Like for example, magkaroon siya og ay mahitabo nga situation, gusto niya na din siya makapitan, na din siya maduulan. So that is agoraphobia. Mr. Dingdong dentist, so is newly admitted to a psychiatric unit because of severe obsessive compulsive behavior. Which initial response by the worker would be most therapeutic for him? So, unsa pud ning obsessive compulsive behavior? So these are people nga naay karibitang unwanted thoughts, no? So we should accept the client's ritualistic behavior, no? Kung unsa pud to ilahang nakasanayan for now, so we should accept it while we are helping them nga ma-change to. Okay? Sa kay napamanggod siya kumbaga first time pa nato siya na deal. So excuse. So before nato sila anuhan good, we should accept their ritualistic behaviors for the meantime. Victoria Malihim is a client with fear of air travel. She is being treated in a mental institution for phobic disorder. The treatment method involves systematic desensitization. The worker would consider the treatment successful if Victoria, so si Victoria daw na ay air travel nga na siya fear when it comes to air travel. So na na daw na siya, na treat na daw siya sa isa ka karing institution for phobic disorder. So in order for us to know nga wala na gud siya ginatawag nga nga fear, the answer is letter B. Takes a short trip in an airplane. So kinahanglan na-try na niya mag-sakay og eroplano or short air trip, air travel, short trip. So karang voluntary gyud nga iyahang yan, no, dili tong kumbaga required, marag i-compulsory nimo siya. So kinahanglan voluntary para maano na to nga kumbaga na face gyud niya iyang fear. So that's it. Psychoanalytic theory explains the etiology of anorexia nervosa as, so a conflict between mother and child over separation and individualization. So kumbaga like karibitong fear karing pag ma-separate ang bata sa iyang mama, di ba, mohilak no. So that is what we call the anorexia nervosa no. For tong bata ta, tong ginaunang pangita is mama. So in psychology or psychoanalytic theory, so ginatawag na siya as kumbaga ang anorexia nervosa is the conflict between mother and child over separation. Okay. Oliver Orongsulong has observed a coworker arriving to work drunk at least 3 times in a past month. Which action by Oliver would best ensure client safety and obtain necessary assistance to the coworker? So si coworker daw, si Oliver daw, nakita daw niya iyang coworker nga hubog mo ato sa ilahang workplace at least 3 times in the past month. So unsa ang best action button ni Oliver? So dili man niya pwede i-ignore because si client ang mabutang salanganin if ever. So make general statements about safety issues at the next staff meeting. So dili man mo na right or dili man mo na responsibility as worker. Responsibility na sa imuhang supervisor. Therefore, report co-workers' behavior to the appropriate supervisor. Kasi supervisor ang mag-take action, dili ikaw. Okay? Di po ikaw ang mag-warn. No? Si supervisor niya. Ursula Punamisan is being treated on a chemical dependency unit. She tells the worker that she only uses drugs when under stress and therefore does not have substance problem. So si Ursula daw na ay chemical dependency. So gingnan niya yung worker nga nagagamit naman siya og drugs pag under stress. No. O ginadeny niya nga naa siya'y substance problem. Therefore, mao ni itong ginatawag nga karibetang defense mechanisms. So ginadeny niya nga naa siya'y substance problem. Therefore, the answer is denial. Okay? Lolita Magtanan recommends that the family of the client with substance-related disorder attend support group such as Al-Anon and Al-Atin. A purpose of these groups is to help family members understand the problem and to maintain focus on changing their own behavior. So that's it. Because they need to be changed, especially karibitang nakakasama. Okay, so letter C ang answer. Maluang, sa mga name Maluang, the sister of a client with substance-related disorder, tells the worker that she calls out her sister Lulu ang Diyos ko. Occasionally, when the latter has too much to drink and cannot work, this behavior can be described as codependent, caretaking, helpful, supportive. The answer is codependent. So because they have kumbaga tells the worker that she calls out her sister Lulu. So dili lang man si Maluang involved. So every time nga na siya is ginatawag niya yung sister. Therefore, the answer is codependent. Okay? So dili lang isa ka taong involved. That is 2 or more. So every time daw nga na mag-ano siya sa for example mag-inom, ginatawag niya yang igsuon. Yung sister nga si Lulu. A client tends to be insensitive to others, engages in abusive behavior, does not have sense of remorse. So when you say insensitive, katong wala sila ipakialam sa ilahang sa kumbaga walay empathy, that is anti-social. So dalian na nato para kasigo siya in 1 hour. Lack of teenage girl is diagnosed to be to have borderline personality disorder. So pag mingon tag borderline personality disorder, again katong na siya negative thoughts, negative feelings about sa iyang sarili and to other people. Therefore, na siya lack of self-esteem. Okay? 5 months after the incident, the client complains to difficult to concentrate, poor appetite. So, naay traumatic event 5 months after the incident. So, na siya post-traumatic disorder. So, medyo saba, just focus lang. Na siya post-traumatic disorder. Okay? Because na may incident nga naitabo. Therefore, the answer is post-traumatic disorder. So, anxiety is caused by subjectively perceived threat. Every time nga na maka-feel ta nga na threat, na ay anxiety. Like for example, nakakita ka na ano nimo nga lanay tao sa gawas, murag na ay mangawat. Nakita na ko tong lalaki na ay nilang pusil. Nya dulaan ra daay. So that is anxiety. No, pag maka-feel ta nga na threat, that is a subjectively perceived threat. Murag natay perceive nga na ay mahitabo nga threat sa tuwa. So that is anxiety. Letter B ang answer. Which factor are associated with the development of post-traumatic disorder? So, the severity of the stressor and availability of support system. So, that's it. Factors associated with development of post-traumatic disorder. Dapat na ay stressors and support system. Okay? So, like for example, stressors. Kato mga post-traumatic event, mga traumatic events. And we have this support system like family and others, professionals. Deviance refers to a behavior or action which people fails to conform or na fail to conform or wala na conform sa norms or nag-follow sa prescribed norms. Okay? Behavior or action. 49. In regard to the function of deviance in society, what does Durkheim argue will happen if we eliminate all serious crime? Society will criminalize less serious action. No? Kung according sa ni Emil Durkheim, if we eliminate all serious crime, katong mga bugat nga kaso, di ba natay ginatawag nga heinous o katong heinous o kalimot ko sa isa, basta medyo light nga crimes. Pag i-eliminate na to ang mga bugat nga kaso or crimes, makriminalize na tong less serious actions. Like for example, dili na heinous ang heinous crime ilisa na to by, like for example managpa, so makonsider na siya as heinous crime, bugat nga kaso. Okay, so which should muscular active engage in criminal activity that somatotype. So the answer is letter C. So this is 1 hour lang magud ang limit sa recording. So Dali lang ang the answer is mesomorph. Check nyo na lang. Okay, good afternoon.